Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 315 of the Ask Dr. Angela podcast. Episode 315, y'all. I'm so excited about that. I've been doing this for a minute, and I'm really happy to say that we finally got the sound issue fixed. I'm going to give a shout out to my guy, Ming, over at A Shared Universe, who came over and kind of tightened up my podcast situation. And of course, my guy over at Moon Lasso, Michael. I have so much love for you and for you helping me to get this up and running again in this time of social distancing. I'm so excited to be back and doing what I do and what I love, which is working, educating women, empowering women, and all of that stuff. So super psyched to be here. I'm having a great day. I am actually working. I'm on call, and so I'm juggling doing this and all the other things that I do, trying to get everything done before I get called back in to the hospital. I do have some things brewing, but I'm going to tell you that the highlight of my day today, actually, I ended up going to the Freehold office, the office that I work for, a Healthy Woman, which is an amazing practice, which is it's fantastic. It's a joy to work there. But anyway, in this time of social distancing, I really don't have an opportunity to see a lot of my colleagues because we practice in different offices. And even if we are in the same office, we're practicing behind closed doors and certainly in different pods. So we can certainly be in the same office and not even cross paths. But today I had an opportunity to see my girl, Dr. Picana, and then I saw my guy, Dr. Joe Cipriano, who was like a brother to me. And it was just good to see people, it's just hard when you're used to being around a lot of people. Not to say that I don't enjoy my own company, because I certainly do, but it was just nice to feel a bit more connected. So today's podcast, we're going to talk about painful orgasms, painful O's. And y'all know I get queries from all over the place, whether it's, from all over the country, all over the world, media queries from all kinds of folks, Cosmo, Vogue, Teen Vogue. I get a lot of queries from online companies. This one actually comes to us from Healthline, and they asked me to talk about painful orgasms. So they submitted their questions in a couple of phases. First off, they said, Dr. Angela, can you speak to the fact that it's not healthy to experience painful orgasms? And also speak to the fact that it's a lot more common than people realize. And so just to speak to that, painful orgasms is officially known as dysorgasmia, and that means painful orgasms. And there's not a lot of stats out there that will actually yield you a rate of occurrence. I certainly looked. And while we certainly do know that dysorgasmia or painful orgasms does exist, I'm not really sure how common it is. And I wasn't able to really come across any literature that could give me a percentile or a rate of occurrence. The next question that they asked in their query was, how can emotional state and mental health affect someone's sexual response and whether or not an orgasm is painful? And that's actually a really good question, because this is what we know. Stress, just like it can be pinned up in our shoulders or our necks, stress can find its, spot in the pelvis. Yes, I'm telling you, women can carry stress in their pelvises. It can be in their uterus, vagina, etc. And certainly the other thing to consider is that any sort of emotional or sexual trauma could also manifest in this way, i.e. painful orgasm. So that's something to keep in mind. The next question that they posed to me was, what are some common physical causes of vaginal or Voer pain during orgasm? And that's like another really good question. And first of all, you need to be able to find a physician that's comfortable talking about these things. Women are already going to maybe be a little bit hesitant or shy to bring this topic up, but you need to make sure that you have a physician that's comfortable enough to have this kind of a conversation with you. And certainly, when I'm addressing any kind of pain, no matter where it is, it's always really important to have a complete exam done, specifically if someone's complaining of pelvic pain of any type. And remember, when we talk about the pelvis, that usually involves looking at the bladder, the pelvic musculature, the vagina, the uterus, the vulva, etc. So there's a lot of players that make up what we consider the pelvis. Obvious physical things that you might find that could cause pain include things like infection, structural causes like cysts, typically like ovarian cysts, although you can also have vulvar or vaginal cysts, fibroids on the uterus, etc. If we're thinking infection, it could be either a vaginal infection, a sexually transmitted infection, it could be a urinary tract infection, or it might be another type of bladder issue that people tend to not consider, but is pretty prevalent, something called interstitial cystitis. Endometriosis and its associated findings could also be a source of any kind of pelvic pain, which in turn could also present as pelvic orgasm. I mean, the list for different causes of pelvic pain really goes on and on and on. I've merely touched base on a few of the more common and obvious ones. So the next question that they posed to me, and they actually posed a lot of questions, is what symptoms indicate that you should be seeing a doctor? What kind of doctor should you see? Is one painful orgasm enough to warrant a visit to the doctor? So this was my response to that piece of their question. As far as I'm concerned, pain of any sort, specifically if it's persistent or happening more often than not, should be evaluated by a gynecologist. If your general GYN is not able to comfortably evaluate the issue, I would recommend seeing a pelvic floor specialist like a urogynecologist. Remember, even if the issue seems to be a bit beyond your generalist expertise, even the most basic of exams and a thorough history can yield a lot of valuable information. And just based on that, again, if your GYN doesn't feel comfortable treating the issue, if they take a thorough history and do a basic exam, they should be able to point you into the right direction in order to have it addressed, whether that means sending you to a pelvic floor specialist or to see someone like a urogynecologist, which basically is a pelvic floor specialist. Are there any fixes for the issue of painful orgasm? What can people do? Certainly, treatment is obviously going to be based on addressing the underlying cause. So you have to identify the root cause of the issue. And that could be physical, it could be mental, it could be emotional, it could be a combination of the three. So, the great thing about me getting these queries is a lot of times my sharing these with you, I'm giving you the complete answer, because when I get the feature a lot of times in these publications, you only get a very abbreviated portion of my response. So I'm happy to be able to feature these on the podcast so that I can give you kind of like, instead of the abridged version, I can give you like the remix, which I love. So that's the end of today's podcast and the topic of painful O as in orgasm. As is the usual, thank you so much for tuning in. I appreciate all the love and all the support. You all are fantastic. I appreciate you beyond. For those of you that are new to the podcast and you liked what you heard or what you're hearing, you can check me out at my website, www.askdrangela.com. That's AskDrangela.com. There you can sign up for my weekly blog post, tongue-tied. You can sign up for my podcast. You can follow me on my social media channels, which are Instagram, Facebook, and Twitter. And as is the usual, I'm going to leave you with a quote from, one of my inspirational books. Again, this one is coming from the Congratulations Graduate. I love this book. Oh my gosh. But anyway, today I'm giving you rules to live by. So here we go. Rules to live by. Number 1, laugh at yourself and at life. Number 2, never neglect the little things. Number 3, welcome every morning with a smile. And last but not least, number 4, set goals for each day. Not long and difficult projects, but small chores that will take you step by step toward your dream. Thank you so much for tuning into today's podcast. I am looking forward to meeting again on episode 316. Until then, choose happiness.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.